Okay, so good afternoon, everyone, and thank you so much to all of you for joining us this afternoon to the launching event of Prezode Pillar Working Groups. We are really happy to have reached this stage now, and really happy that all of you were able to join for the group presentation and a more general presentation of Prezode and its strategic agenda for the upcoming years. In order to start this event and present to you the work that we will do, I will now give the floor to Dr. Papasek, the president of the General Assembly of Prezode. Papasek is from Senegal and will now give you a quick talk about our work. Thank you, Papa. The floor is yours.
Thank you so much. Dear distinguished Pillar Working Group members, dear Prezode members, dear guests, as the president of the Prezode Initiative, I'm well honored to welcome you to the launching event of the Prezode Pillar Working Group, which represents the core activity of our initiative. Prezode is an international science-led One Health initiative that was launched by France a little bit more than 3 years ago. Today, Prezode brings together more than 240 members from more than 80 countries around the world, including 26 governments and more than 215 different entities such as research institutions, academia, civil societies, health agency, industry, and others, with a common goal of advancing research, advocacy, and international collaboration to prevent, reduce, and tackle zoonotic disease emergence. The first phase of the initiative was focused on raising global awareness of Prezode and its goal to prevent zoonotic disease emergence, to gather high-level political support, and to develop its strategic agenda as the initiative research and operational roadmap for the next years. With the launch of the Pillar Working Groups today, Prezode is moving forward from visionary ideas into impactful actions. The Prezode Secretariat has received applications from well-qualified scientists and experts within the extensive global network of initiatives to join the work of the 5 Pillar Working Groups. Currently, the Pillar Working Groups are comprised of 90 international experts from the science community and members from the Prezode Secretariat originating from 36 countries. I would like to take this opportunity to thank all Prezode members who nominate experts to serve on the Pillar Working Group, and all experts who will provide their time and expertise to the work the Pillar Working Group is developing as research framework to undertake the emergence of zoonoses in the context of global change. I would like to congratulate you all experts with Sudan for this work, because we know that you have well-known expertise, and you will give all your time and also your expertise in this working group we are launching today. As all the Pillar Working Groups members, a successful term and to achieve the aim and the goal of the Prezode strategy agenda, and to advance research in the field of zoonotic disease mediums that will support global efforts to prevent future pandemics. I would like to thank all of you for joining us today to learn more about the Prezode Pillars Working Group, and I leave the floor to the Prezode Global Scientific Officers, Manan Lunas and Elza, to present to you the strategic agenda and the pillar working groups, general overarching goals, objective, and competition. Once again, thank you for joining our scientific family and technical family. And here I would like to thank you for listening. I open officially this meeting of the launching of the Prezode Pillar Working Group. Thank you for listening. Over to you.
Thank you very much, Papa, for this great introduction. I also want to inform you that there is a Q&A session that will be held after the presentation of the groups, but feel free to ask all your questions during the presentation, and we will try to answer them at the end of this presentation. We will now have a presentation by Manon Lunas, Global Science Officer of Prezode, of the strategic agenda and the pillars of Prezode. Thank you.
Thank you, Elsa, and thank you, Papa, for these very inspiring words. So we are very pleased to launch these pillar working groups. As it was said, we are moving from ideas to concrete actions, and so I will present you the framework developed during the past 3 years, where we develop these ideas, and that will be the basis for develop those concrete actions through the pillar working groups. So here you can see the scope of Prezode. So let me just here, okay. And so the Prezode initiative focuses its activities on the pre-emergence and pathogen spillover and emergence phases. And so the paradigm shift promoted by the initiative is the implementation of prevention strategy based on the concerns and needs of local communities and frontline actors. So the development of adapted and innovative prevention strategies relies on an integrated, interdisciplinary, and cross-sectoral approach involving human, animal, and environmental health, actors in research, policymaking, and working in the field at local, regional, and global level. So what is not in the scope of the Prezode initiative is represented here by the dot line, is all processes related to the post-emergence phase of pathogen in human population. So we are really focusing on upstream prevention actions, as well as we will not focus on approaches that aim to improve the epidemiological response, such as the development of vaccines, drugs, or improvement of contact tracing, etc. So all of this fall outside of the scope of the Prezode initiative. However, of course, there are many synergies and complementarities between studies and the surveillance needed in the pre- and post-emergence phases, and additionally between approaches toward prevention, preparedness, and response, such as the development of innovative diagnostic solutions or integrating data systems. Next slide, please. So the aim of Prezode is represented here on 5 pillars. And so we have the pillar 1 on understanding zoonotic risk and risk activities, the pillar 2 on the co-designing of solutions to reduce zoonotic risk, the pillar 3 on strengthening early warning system to detect zoonotic risk, the pillar 4 on prototype a global information system for surveillance and early detection, and the pillar 5 that is a cross-cutting pillar on engaging stakeholders and co-design One Health network and policies. So a series of regional and international co-construction workshops were organized starting in 2021, and we used these co-construction workshops really to develop a strategic agenda describing the vision and the scientific and operational framework of the initiative, As we gathered a lot of stakeholders from a lot of regions of the world, we had so many contributions that have been synthesized in this one document, presenting the vision, objective, and action plan formalized around this strategic agenda. You will find in this strategic agenda a mention of ethics and policies, the evaluation of the impact. So we based our approach using an ex-ante impact evaluation method, so based on the theory of change. And also there are some key elements of the Prezode initiative, such as the governance. And finally, we have a section presenting the synchronization with the One Health joint plan of action. So you can find this document. This can be downloaded in the Prezode website. So don't hesitate to have a look at it. Next slide, please. So here you can see the strategic agenda is summarized around the theory of change impact pathway. And so we have the impact, that's what we want to reach, and then the pathway of change, what we need to do to reach the impact. Next. So the impact is the vision, and the pathway of change are the mission of the initiative. And so we will reach this impact through 6 action tracks that are basically the 5 pillars of Prezode, plus a transversal action tracks gathering ethics, sustainability, and implementation framework. So for each of these action tracks, we identify high-level actions based on so the literature review and the contributions of participants during the co-construction workshops. And then we identified the outcome at a medium term and a long term. So really this figure is to summarize what you will be able to find in our strategic agenda. But today I will really focus on the action tracks and the high-level actions, because those are the themes on which will be based the work of the pillar working groups. So let's start with pillar 1 on the understanding of the zoonotic risk and risk activities. So we identified four sub-themes or high-level actions. The first one being determine what is a zoonotic emergence risk, then understand the mechanisms and players in zoonosis emergence, understand the drivers leading to zoonotic emergence, and finally identify strategies to anticipate the risk and decrease spillover likelihood. So for the second pillar, on co-designing solutions to reduce zoonotic risk, we identified 5 high-level actions. The first one being on the use of ecosystem conservation to mitigate spillover, then regulate and trace commercial and non-commercial activities related to wildlife, then develop innovative systems of livestock management and agriculture, finally, design of urban space, and articulate between all the risk reduction strategy and engaging the actors in those strategies. Regarding the pillar 3 on strengthening early warning systems and surveillance systems to detect zoonotic risk, we had 3 high-level actions. The first one being assessing current surveillance system and practices, to then develop context-specific and user-based surveillance system, and develop innovation in surveillance protocols and diagnostic tools. Sorry. Then on pillar 4, that is prototyping a global information system for surveillance and early detection. So this pillar is really about the interoperability and sustainability of surveillance system and global standards, define the type of surveillance and objectives, and identify relevant indicators and data. Then action plan linked with global surveillance, strengthen infrastructures to operational global surveillance systems, and finally, optimization of efforts to avoid duplication. Now regarding the pillar 5 on engaging stakeholders and co-design One Health networks and policies, we had 3 high-level actions. First, the community involvement, then the co-development of health networks and policies, and finally, promote One Health approaches and intersectoral collaboration. Regarding the 6 action tracks on transversal high-level actions, we identified strengthening country capacity to implement One Health approaches for zoonosis risk prevention, then the coordination of funding to ensure sustainability of intervention. A third high-level action is the harmonization and coordination of data collection, sharing, and analysis. And this is completely related to the International Data Working Group that will be mentioned at the end of this webinar. Then the development of international ethical guidelines and policies. And finally, endorsement of projects through a Prezode label or endorsement process.
Thank you very much, Manon, for this presentation of the strategic agenda and some high-level action, the scientific roadmap of Prezode and the high-level actions that will be undertaken by the pillar working groups. I will now present in more detail what are the common objectives and the overarching goals of these 5 pillar working groups. The aim of this group is, as Manon said, is to develop joint recommendations and actions in a co-creation process to support the international organizations and the countries across the globe in preventing zoonotic disease emergence and the spread of this disease, and particularly in low-income countries or in the global south, where most of the outbreaks sometimes occurs. Is also to develop a research framework to understand zoonosis emergence in the context of current global changes and to implement current operational programs. And these pillars will have the task to identify concrete actions to the development of these strategies to both minimize the exposure of the human population to zoonotic pathogens, but also in the meantime, not impacting public health dimensions such as food security, nutrition. In a more concrete way, there will be short-term objectives for these 5 pillar working groups. One of them would be to update and revise, if needed, the list of operational needs and research gaps that were identified in the workshops for the creation of the strategic agenda, and refine, if needed, this strategic agenda of Prezode. The pillar working groups will also have the objective of identify funding opportunities and potentially reply to funding calls in order to develop some projects and some tasks within the pillar working groups. And we'll also propose data and information exchange mechanisms. And this will be done in relation to the International Data Working Group. On the more mid and long term, the pillar working groups have to identify and prioritize international studies and promote collaborative research and projects that can address the need of the pillar working groups and the need of the pillars of Prezode, 5 pillars of Prezode. I say identify and develop concrete actions to reach the outcomes of the strategic agenda, but also develop international study to frame science and develop high-level papers, but also contribute to the development of Prezode sharing platform, again, in collaboration with the International Data Working Group, but also identify common actions and synergies between the pillar working groups, between the 5 pillar working groups, but also between these groups and different projects or global initiatives worldwide, and by promoting collaborative research projects and reinforcing Prezode networks activities. And to reach all these objectives here, this could be done with different deliverables produced by the Pillar working groups. And as example, it could be build up a global database linked to a policy document, produce scientific publication, whether it is opinion papers, literature review, different type of scientific publications, but also perform or propose a system assessment, or also develop a methodology to evaluate the impact of Prezode, produce reports on concrete actions that are needed for the prevention of zoonotic disease, inform policymakers by producing policy briefs, but also develop the outlines and describe the outlines of a sharing platform, again, in collaboration with other groups as international data working groups, and also list the research priorities, such as the one that I included in the strategic agenda. And these new research priorities identified by the experts in the Pillar working groups will be included in the next version of our strategic agenda. We will now move to a more specific presentation of the groups and more specific objectives. So we are today launching the Pillar working groups, and all these groups will independently have a kick-off meeting where these specific objectives and deliverables will be discussed, again, with all the experts and the members of the Pillar working groups. But we'll quickly present you what are the objectives of the groups and who are our experts in these 5 Pillar working groups. I will now give the floor to Dr. Aitor Nogales to present Pillar Working Group 1. Thank
you. Thank you, Elsa. Can you go to the next slide, please, first?
Yes, of course. Is it okay for you?
Or yeah, perfect. Yeah. Yeah, first of all, I would like to thank all the new members of Pillar Working Groups 1 for accepting the invitation to join Prezode and for the commitment to dedicate some of their time and their busy agendas to this. I think in Pillar Working Group, there are researchers and people from different areas of the world and with different but very complementary expertise and backgrounds. Anyway, in the kick-off meeting for this Pillar Working Group, we will have the opportunity to talk more about the goals of this, what is expected from us, as well as the time for the presentation of all the new members in this Pillar Working Group. Can you go to the previous slide, please? Thank you. So the goal of Pillar 1 is, the main goal is understand zoonotic risks and risk activities. And for that, 4 high-level action or main objective has been highlighted. The first one is determine what poses a zoonotic emerging risk, meaning what is a zoonotic emergency risk and an interface of risk. So, for instance, some of the milestones or deliverables could be a list of key terms or link it to zoonotic emergency to be defined. Also, review and collate the list of priority pathogens in the different regions of the world. The second one, understand the mechanisms and players in zoonotic emergency that involve the pathogen, the host, and also the environment. And some of the milestone deliverables, for instance, are review the literature to identify common and specific mechanisms related to priority pathogens in different areas, population, etc. So also develop examples or training scenarios for models or exercise. Third, understand the drivers leading to zoonotic emergency. For instance, some of the potential deliverables or milestones could be lists of models that can be used to improve our understanding of zoonotic risk and emergency. And finally, but last but not least, identify strategies to anticipate risk and decrease spillover likelihood. So this one is highly relevant and important. And for instance, we should identify key areas of research to prevent zoonotic infectious diseases or do a recommendation for implemented One Health approach for anticipating the zoonotic disease risk and decreasing spillover likelihood. So we have been working in a draft document, including some potential milestones and deliverables for each of these main goals, objectives for Pillar Working Group 1. And I think the draft document will be shared with all of you soon. And we will have the opportunity to discuss this in another issues in coming meetings. So thanks again to all the new members, and I'm looking forward to work with all the Pillar Working Group in this and other goals. So thanks, and over to you, Elsa.
Thank you very much, Aitor, for this great presentation of Pillar Working Group 1. We will now move to Pillar Working Group 2. And thank you, Benjamin Roche, for presenting this group as a science focal point of Pillar Working Group 2.
Thank you, Elsa. Hi, everyone. Very glad to be here. So the Pillar Working Group 2 is really about co-designing solution to reduce the zoonotic risk. So, of course, there will be a lot of interactions with our Pillar Working Group, including, of course, Pillar Working Group 1. So the first thing, so based on the strategic agenda, of course, and the first meeting we had, we have identified a couple of first high-level actions, just in order to structure it a bit our thought. And so, of course, all of this will be discussed during the Pillar Working Group 2 kickoff meeting in several days or week. So what we have identified in this first brainstorming meeting about what we can do in this Pillar Working Group. So the first one is to identify data types that needs to be exchanged regarding prevention strategies. We know that data interoperability is at the heart of prevention, so that's an effort also that will be done in interactions with the Pillar Working Group 4. Sorry. We want also to map so the different co-design methodology that has been used towards risk reduction strategies in order to have some kind of panorama about what has been done in terms of methods and in terms of course of outcomes. Another thing is to identify what are the different priorities for the different zoonoses through the world that could be addressed by prevention. So the idea is to have a look on in each country, each regions, what are the zoonoses identified as priority by the different regional entities, by the different countries, in order to really map all this priority through the world and to try to target our efforts towards this high priority list. So the fourth high-level action objective is to continue the effort that is currently doing through a joint working group between WHO, the World Health Organization, and Prezode towards developing indicators for the risk of zoonotic exposure of human populations. So this is something that is conducting since a year now, but is going to be released next month. So the idea is to have an indicator that can quantify or at least qualify the risk of zoonotic exposure of human populations in order to understand and to characterize how much the risk has been reduced following the implementation of prevention strategies. So the idea in this Pillar Working Group 2 is to continue this effort. It is also to develop co-learning and co-training of co-design methodologies in order really to also have a good panorama, so to use the panorama of the different methodology that has been mapped before in order to see what kind of methodology can be implemented with whom and where to do what. And finally, is in conjunction with what Pillar Working Group 1 is to identify what are the drivers of zoonosis emergence, and of course, what are the methodologies to address this driver in order to prevent zoonosis emergence, which is really at the heart of a lot of activities across the different Pillar Working Group. So next slide, please, Elsa. Yeah, so far we have different experts who have joined this Pillar Working Group. Probably this Pillar Working Group has to be completed by other experts, but that will be a discussion we will have at the beginning of this Pillar Working Group to see what kind of skills, what kind of competencies we need to address these different high-level actions. So I'm going to serve as a science focal point with my colleague Audrey Arnal from IAD. This pillar working group is going to be chaired by Warafon Fimparapai, I hope I pronounce it correctly, and it will be co-chaired by Ricardo Suarez Magalhães, Prisca Mugabe, and Gerardo Souza. And I think I'll stop here. Over to you, Elsa.
Thank you very much, Benjamin. We will now move to Pillar Working Group 3, and Dan Vink will present as a science focal point for this group.
Hi, Elsa. Hi, everyone else. Nice to be here today. Could you go to the next slide, please? I think it'd be good to start with that one, just to get an overview of who's in this group. As Elsa mentioned, I'm the science focal point for this group, and I'm presenting on behalf of Wim van der Poel, who's the chair of the group. We have co-chairs Christophe Cordevant, Manuel Miller, and various other experts. And for those of you who are on the call today, we're really looking forward to getting started on some of this work. Back to the previous slide, please. So just to mention, we really are looking at this very strongly through a One Health lens. And so from a surveillance and early warning perspective, we're really looking at it from a perspective of integrated activities and surveillance. In terms of high-level actions and objectives, we set three. The first one's to look at what is currently happening in terms of surveillance systems and practices. The second one is really thinking about context-specific and user-based surveillance systems, what they might look like. And then thirdly, considering what sort of innovations might be implemented in future, also specifically looking technically at diagnostic tools and methodologies. In terms of the first one, what we discussed within the group was to be able to assess current surveillance systems. First, we have to have a decent understanding of what is currently happening out there in terms of surveillance, particularly in One Health or interoperable intersectoral surveillance systems. And so in terms of the deliverables and milestones that we set, we're really looking towards doing some sort of scoping review to inventorize that. Secondly, also assessing where possible and where there is information, how those systems are performing in terms of their economic performance and efficiencies. In terms of context-specific and user-based surveillance systems, firstly, it's developing a stronger understanding of the surveillance system stakeholders, particularly again within that One Health context. And so in terms of the deliverables, there would be various mapping activities and similar to really scope and identify who those stakeholders may be, but also critically, what are their knowledge, attitudes, and practices, what are their behaviors, and what are their roles within those systems. Secondly, looking at what sort of design criteria and methodologies would be applied following on from that to design effective and efficient user-based health surveillance systems. In terms of innovations, it's again doing something like a scoping review of identification of cost-effective and efficient diagnostic methodologies to underpin surveillance and similar. As a summary, I think I'll leave it there. So Elsa, back over to you. Thanks everyone for listening.
Thank you very much, Dan, for this great presentation of Pillar Working Group 3. Paola Caceres from INRAE, who is serving as science focal point for Pillar Working Group 4, will now present this group. Paola, would you like to start with the map or with the objectives?
Well, probably with the map to follow the trends. Thank you. And I would like to thank also for all the 11 experts that apply, as you can see in this slide. And in the map, you can see the distribution of all these experts that we will work for this pillar working group. I would like to inform you that Sarah Olson, who is the chair of the Pillar Working Group 4, is unable to be with us today, so she regrets not be being able to present at this first learning session. So I take advantage to inform you that also we have two co-chair, Gabriel Maghesi and Banafon Pautana. I think this is the correct. So we can back to the other, the first one. Okay, thank you, Elsa. So as we can see in this slide, we have 5 high-level actions as were presented by Manon. And the first one is interoperability and sustainability of surveillance system and global standards. The second one is define the type of surveillance and objective and identify relevant indicator and data. Action plans linked with global surveillance and strengthen infrastructure to operationalize global surveillance systems. And finally, optimization effort to avoid duplication. For each of these high-level actions, we have proposed some activities that we believe could be developed. And the idea is, as the colleague also stated, we will ensure that all the proposal activities will be reviewed for during the kickoff meeting of the Pillar Working Group 4 to ensure that all these activities are aligned and integrated with our objective. So I will not go, I think it will be okay. And I hope that is clear enough. And thank you. Thank you, Elsa. Over to you.
Thank you very much, Paola, for the presentation of Pillar Working Group 4. And now the final Pillar Working Group, and Marisa Per will present as a science focal point.
Thank you very much, Elsa. I just want to check if Musso might be able to do that.
So Musso is connected, but I think he's got a connection issue.
Yes, just checking, just in case it's better. So thank you very much. Hello, everyone. It's a real pleasure to be here and part of this launching of the working group to present on behalf of Musso Muniem from the University of Zambia, who's the chair of the Pillar Working Group 5. And the co-chair of this Pillar Working Group are Magda Robalo and Casimiro Vizzini and Neil Vora. And I present as a science focal point for Prezode. So you can see on that slide the really high-level experts that were interested and able to join this working group. Thank you very much to all of you to want to work all together on those very interesting activities that is embedded in the Pillar 5. And you can see that it's covering wide regions in the world. So that's nice. And we will try to maybe get some more insight from Latin America by asking more experts to join the group with time as well. Thank you very much. Yes, so if I go into the high-level action and objective that we have discussed and proposed to start working on. So the first one is really about community involvement and looking at how to guarantee community involvement and actor engagement. And that would be looking into specific co-design methodologies with this specific objective that would be very complementary to what the Pillar 2 is proposing. Then also to really work on really improving actor engagement across sector. And that type of methodology will help as well in building that and how this co-design methodology can support this actors' engagement. And we will also need to better understand the stakeholder space by working on actor mapping at all levels. And the working group can provide the methodology and operational means to be able to start building or consolidating a database of actors. Then the second high-level objective is working on the co-development of One Health and One Health network and policy And that embeds a better understanding of international existing funding mechanism. And so the idea behind it would be to identify the opportunities for collaboration and share the information with the identify stakeholder and engage in their cooperation. That could be in the form of an exchange platform. And there was some discussion about some kind of meet and match app. And the mapping of the financial landscape could be interesting to see how one else, where one else falls out and is not being covered, and to identify the gaps and to see how we can promote and advocate to donors to really address those gaps. And then the third high-level action that is on our agenda would be to promote One Health approach and intersectoral collaboration, including identifying ethical issues that is linked with this implementation of the One Health approach. And that includes a One Health policy integration between level, including the local context. So how can we make sure that the guidelines goes from local to national to high-level regions, high level to inform policy, and also working on the One Health status in country and relevance for prevention. And that includes a study that has started and that we will work together on the mapping and documentation of the One Health situation in country and trying to better understand what are the challenges and obstacles, if any. And more in link as well with the equity issues would be to brainstorm on the best practices on how to better ensure this equity applies at large scale and through large international funding, and to ensure that the communities and the local perspective are accounted for. And of course, this will support Prezode strategy, and the idea would be to work on guidelines for member mobilization so that Prezode members can support this advocacy work all throughout the different regions of the world. Thank you very much.
Thank you very much, Marisa. So as you all can see, a lot of work will have to be done. And there are a lot of common objectives between the Pillar working groups, so a lot of projects that can be built between the different Pillar working groups. If you now have some questions, have a bit of time to answer to your questions. I can see that there was someone asking if all experts were from academia and government or also private sectors. The experts of the different Pillar working groups are coming from many different sectors. So we have researchers from academia and also the private sectors. We have people from international organizations such as WHO, FAO, or WOHA. And we have experts all really coming from all the different sectors there. So we will indeed share documents. So the kickoff meetings are coming in June, and we will share relevant documents with all the experts, members of the Pillar working groups. So regarding the chairs and co-chairs of the 5 Pillar working groups, they are all members of the steering committee of Prezode. And these, they are under the scientific college. And so this is how the chairs and co-chairs were selected among the steering committee of Prezode. Sorry. Yes, Manon?
No, sorry. I was about to take the question from
Yes,
from
absolutely. I will let you answer the next questions.
So regarding the timelines, the outputs planned, so this is exactly what you will discuss during the kickoff meeting of your pillar working group. So really the objective will be to discuss on the first output and to develop a roadmap for your group that is realizable. I mean, really with clear timeline and objectives that can be achieved in 3 months, 6 months, 1 year. And so, yeah, this will be the first step. So we have 2 phases, and the first phase is really to together construct this roadmap and find more realistic outputs that are achievable. Just checking if we answered the other question. What happened after this work is done? So all the work done will be included in the new strategic agenda of the Prezode initiative. So we will produce a new version, and so all of that will be included on that. Of course, if there are some actions that could be published, they will be published. So yes, that will be. And so the steering committee is leading these pillar working groups. And so at midterm, of course, we will, as we have chairs from the steering committee, we will have a discussion with the steering committee on the next step and if we should revise the roadmap and so yeah, that will be. So now we are envisioning for 2 years, and then we will have another discussion on the next step.
Paola, did you wanted to answer to one of the questions?
The question from Gustavo?
Yeah, I don't know, because it was indicated that you wanted to answer to one of the question.
I know, no.
Okay, sorry.
No.
So there will be specific meetings where each pillar working group will meet independently between every 4 to 6 weeks. And there will also be joint meetings where all the experts from the different pillar working groups will meet together to discuss joint actions and synergies and progress of the different pillar working groups. I think the frequency of the meetings will be discussed within each pillar in order to find what works best for everybody. So a call was launched at the end of last year, a call for experts, and the call was closed in January. So we received almost 70 applications, and the experts were selected by the steering committee of Prezode, taking into account so expertise that was needed, gender balance and geographical balance. Obviously, depending on the actions of the different pillar working groups, more expertise might be needed at some point, and whether a new call will be launched or experts will be contacted directly. But there might be other opportunities to join the pillar working groups in the future, and this will be advertised widely by Prezode at that time. if there is no other question, I think we can move to the next stage. And so as we say, today we are launching 5 pillar working groups officially. In June, we will have kickoff meetings of each pillar working groups. And after these kickoff meeting, we'll try to organize a joint meeting with as many experts, science focal points, and chairs and co-chairs as possible. Obviously, there are, as Papa Sek said at the beginning, we have 90 members of the 5 pillar working groups. So it might not be possible to get everybody at the same time together, but we'll do our best. And so the work of the pillar working groups will start in June, and first actions discussion will carry on during the summer. In October, there is the Prezode General Assembly, where the work of the pillar working groups will be presented. And I would say we presented short-term and long-term objectives within 1 year to up to 5 years. So there are a lot of things coming within the upcoming months and years.
Yes, Manon, if you allow me, I would like to add something on what you already said.
Yes, absolutely.
Yeah, thank you so much. I thank you all for the very valuable presentation you did. And I would like talking about the involvement of experts in the pillar working group. As we know, everybody can't be involved in the pillar working group, but it's a pleasure to highlight that we will be in contact with all communities, scientific communities, but also civil society communities. And as Marisa already explained, there will be some networking with all the community around the pillar working group, and they will take stock on what really the scientific communities around, but also the civil society communities are doing in regard of the different thematic we deal in the pillar working group. I would like to say that because I know that civil societies, relevant stakeholders are doing very good job in the field of One Health. And the example I would like to highlight here is the INB meeting for the pandemic treaty in WHO. The civil society are doing very relevant and meaningful work behind to backstop, to get good decision toward the One Health implemented, etc. So we remain really open to connect with all relevant contribution in this regard. Thank you so much, and congratulations again for the work well done. Thank you.
Thank you very much, Papa, for your intervention. We have a few additional questions that came out, and might have 1 more minute to answer to them. So regarding the International Data Working Group, I'll come back to this in 1 minute. So far, experts were selected for 1 group and only 1 group. I think the possibility that experts from 1 pillar working group participate in another pillar working groups must be discussed probably with the group themselves, and this can be discussed during the kickoff meeting, or request can be probably sent to join, if you already are in a pillar working group, to join another pillar working group at the same time. Obviously, this might also require a lot of your time, but yeah, this can probably still be discussed. Regarding, yes, Manon, if you want to
jump in on that, yeah,
take the floor.
Just to mention that some actions might be linked between the groups, and of course we will adapt, and we will organize some transversal working group on specific topics if needed. So what is the idea will be to encourage the exchanges between the groups, especially to avoid overlapping and to find the best way to collaborate and not have each groups working on their actions only.
Thank you, Manon. Do you want to also answer the final questions that is still open?
Yeah, it's not an easy one. So regarding how we will manage with synergies and how can organizations with similar activities work with Prezode activities. So I would say first, maybe to inform us if there are some similar activities, so I think the first step would be when we will launch concrete actions would be to have a screening on what is already done and to see what is missing. So of course, please don't hesitate to share with us if you are engaging in actions that could be linked with what Prezode is doing, and then we will try to do our best to avoid duplications. But I agree that it's very hard to get aligned on the timeline. So,
and the if I can add, the interesting thing is also that we have members of Prezode and members of the Pillar working groups that are part of these organizations also. So this can also create a link and communication between Prezode and other organizations, or between the Pillar working groups and other organizations, and try to achieve synergy or also avoid redundancy and duplications. But also discuss timelines to try to really align with other organizations. So maintaining a link and communication between Prezodes and other organizations or other initiatives is really important and necessary, obviously. So we multiple times mentioned the Prezode International Data Working Group. In the so effective data and information management is indispensable for infectious disease prevention and control, and this is really at the heart of Prezode. So in the strategic agenda, we highlighted the necessity to reinforce accessibility to robust information for research, but not only, also for operational programs and for public awareness. So management of data, sharing of data, making data open access, but also protecting data is really important. To this goal, to this aim, Prezode established a cross-pillar international data working group that involved all the 5 pillars working group, but also goes beyond this, and it will assemble a team of experts from diverse backgrounds in order to streamline access to and utilization of data from Prezode-funded projects, but not only, also from other relevant data sources, as I say, whether it is research projects or operational programs, so many different sources. So the call for experts for this international data working group is still open until the 4th of June, if I'm 5th of June, sorry. So do not hesitate to go to Prezode website to have more information. If you're interested to join, just reply to the call for experts. And if you have any questions or require more information, you can contact Paula, and she will be very happy to give you more details about the International Data Working Group. And this working group will work in close collaboration with all the pillar working groups of Prezode. So this webinar is now reaching its ends. Thank you very much to all of you who joined us today to the launching of the pillar working groups. We are really, really thrilled to start the work of these groups, and we are extremely happy to work with all the excellent experts that join the groups, and really looking forward to our next meetings together. Thank you again to all of you.
Thank you.
Thank you so much. Thank you.
And
Thank you.
congratulations for you
Bye.
too. Thank you.
Thank you.
Bye-bye.